Hello everyone, welcome to our channel Curing Dairy. Today let's see about diabetes. Let's look into what is diabetes followed by its types and its complications. Then what are the ways to maintain the blood glucose level, also the foods that can be taken and avoided by the person having diabetes. What is the normal range of sugar a human can have? Then the difference between hyper and hypoglycemia. Finally, how acupuncture helps in treating this case. What is diabetes and its types? Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose. Hyperglycemia, also called raised blood glucose or raised blood sugar, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke and lower limb amputation. Mortality risk rate with age. Types of diabetes are Type 1, Type 2, gestational diabetes and prediabetes. Now, what is Type 1 diabetes? Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition. In this condition, the pancreas makes little or no insulin. Insulin is a hormone the body uses to allow sugar, glucose, to enter cells to produce energy. Different factors, such as genetics and some viruses, may cause type 1 diabetes. Although type 1 diabetes usually appears during childhood or adolescence, it can develop in adults. Even after a lot of research, type 1 diabetes has no cure. Treatment is directed toward managing the amount of sugar in the blood using insulin, diet and lifestyle to prevent complications. Type 1 diabetes symptoms can appear suddenly and may include feeling more thirsty than usual, urinating a lot, feeling very hungry, losing weight, feeling tired and weak, having blurry vision. Next, type 2 diabetes. Type 2 diabetes, formerly called non-insulin dependent or adult onset, results from the body's ineffective use of insulin. More than 95% of people with diabetes have type 2 diabetes. This type of diabetes is largely the result of excess body weight and physical inactivity. Symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. Until recently, this type of diabetes was seen only in adults, but it is now also occurring increasingly frequently in children. Symptoms of type 2 diabetes are increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections. Now it's gestational diabetes. Gestational diabetes is hyperglycemia, with blood glucose values above normal, but below those diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening, rather than through reported symptoms. Finally, prediabetes. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into cells for use as energy. If you have prediabetes, the cells in your body don't respond normally to insulin. Your pancreas makes more insulin to try to get cells to respond. Eventually your pancreas can't keep up, and your blood sugar rises, setting the stage for prediabetes and type 2 diabetes down the road. Symptoms of prediabetes: being overweight, being 45 years or older, having a parent, brother, or sister with type 2 diabetes, being physically active less than 3 times a week, ever having gestational diabetes, diabetes during pregnancy, or giving birth to a baby who weighed more than 9 pounds. Having polycystic ovary syndrome. Complication of diabetes. There are few complications of diabetes. Let's have a look into it. They are stroke, heart attacks, peripheral artery disease, diabetic retinopathy, cataracts, glaucoma, diabetic foot, diabetic nephropathy, peripheral neuropathy. Ways to maintain the sugar level. Keep track of your blood sugar levels to see what makes them go up or down. Eat at regular times, and don't skip meals. Choose foods lower in calories, saturated fat, trans fat, sugar, and salt. Track your food, drink, and physical activity. Drink water instead of juice or soda. Avoid alcoholic drinks. Avoid sugary foods. Control your food portions, for example, use the plate method. Fill half your plate with non-starchy vegetables, a quarter with lean protein, and a quarter with a grain or starchy food.